And this is Social Impact Live today with our special guest, Michael Friedman, who is formerly a Deputy Commissioner of the New York State Office of Mental Health, has been on the faculty at Columbia, and also, most importantly, formerly host of this show. So welcome back, Michael.
Well, thank you very much, Richard. It's terrific to be back at Columbia, even if it is virtual. It's good to see you again, get reconnected.
Thank you very much, and thanks for coming on the show today. And we've got people tuning in from Michigan, Connecticut, New Jersey, New York City, Buffalo, California, North Carolina, Hudson Valley, South Carolina. So we've got people all over here to listen and hopefully give us some feedback and input into what they've been thinking about and experiencing with regard to the psychological fallout of this COVID-19 pandemic that we're all experiencing. So we'll have an opportunity, certainly at the end of the show, to do our traditional Q&A, but please get your questions in early, and the producer will be passing them along to Michael and me, and we'll have an opportunity, I hope to address them during the course of the show as well. So, Michael, psychological fallout. We're looking at something that's really unprecedented, right? The scale and scope of what we're experiencing in terms of disruption to our life, to our lives now as a result of this pandemic. And from a mental health perspective, I mean, what do you see as well, sort of the core issues here?
Well, I think, first of all, it's important to emphasize what you just said, and that is this is an unprecedented event. It turns out that there's very little research that's been done about the psychological consequences of pandemics, in contrast to disasters, where there's a tremendous amount of research that's been done. But the little bit of research that's been done just fits common sense, it seems to me, because what it says is that there will be some people who during the period of a pandemic will develop new diagnosable mental or substance use disorders. There will be a lot more people who already have or have histories of mental or substance use disorders, and their conditions are likely to be exacerbated. There's particular risk of relapse. So if we think about a person with a serious and persistent mental illness, psychiatric disability, people who have been able to make a life for themselves are in what's called recovery. This kind of stress can really just be terribly disruptive to their lives and to their recovery. The same thing is true with substance abusers. And I worry particularly about substance abusers because so many of them rely on mutual aid groups like Alcoholics Anonymous or Narc Anonymous and so on and so forth, many of which are held in houses of worship. And they're closing, and I don't know where people are going to be able to go to have those groups, and whether we'll be able to address that with telecommunications. And then, of course, the third group are everybody. We are all affected emotionally by what's going on. We are frightened, we're sad, we're lonely, we fear for our own lives, we fear for the lives of our family. We experience tensions in the home as we are in virtual quarantine, and some of that becomes very difficult to handle, and so forth. So there are just a range of emotional issues, not the least of which is grief, and maybe later we'll talk about that a bit more.
Yeah, so yeah, I certainly don't want to forget vulnerable populations, people who might be at higher risk as a result of, for example, the social isolation that is going on now. They like to call it social distancing, but it's really more along the lines of physical distancing. But people are losing that human connection. So yeah, I mean, more generally, what are the dangers you think of just isolation with regard to mental health?
Well, I think there's a lot of literature that says that social isolation is
Right.
it creates high risk of both mental and physical disorders. So I think we know a lot about that. The distinction that you just made between social distance and what some people are now calling spatial distance
Mm.
is a very important distinction, because people who are alone are not necessarily people who are disconnected. We're talking on Zoom. That's people talk on the telephone, people talk on video conference. People can stay connected through all of this, at least some people can. And so it's very important to understand that merely being alone or cut off from the usual physical contact you have with people is not the same as being in social isolation
Mhm.
in the way we often think about it. But
Mm.
I think, we also need to talk about people. You talked about vulnerable populations. Old people like me are among them, but I'm much more concerned about the people who are experiencing the economic catastrophe
Right.
of this. You and I are lucky people. You're at home wherever you are. You've got a job. You've got a salary. You're not worried about where your next paycheck is going to come from. And so
Mhm.
far, you can get food. I am a retired person. I have a regular income that's coming in. As of this morning, 10 million unemployed in the United States.
Wow.
10
Yeah.
million unemployed. Now, do you know what that does to the emotional state of people who have worked and earned a living and taken care of their families, and now suddenly they're worried about how they're going to put more food on the table? Think about
Mhm.
a single mother who now has a kid at home, and she was a person who worked by the day, and maybe a waitress came home with tips and used those tips to put food on the table for her kids.
Mhm.
Oh, I mean, the kind of experiences that people are having there, and even less extreme, the people who are stuck at home and just are struggling to
Yeah.
manage a household. But particularly the people in economic stress. And of course, one of the other things that's happened is that there's been a rise in racism towards Asians. That must
Mm.
be a really difficult thing for them to manage. I frankly think that if the economy continues as it is, we'll see a rise in racism generally, because
Mm.
that's a typical consequence of economic catastrophe. And
Right.
that will also have significant psychological consequences. So, again,
Mm.
I just think it's important that we understand the emotional struggles that you and I have, and that people
Right.
like with resources have, and there are real emotional struggles that we could use help with. But the disadvantaged populations, wow.
Yeah, we have to think about how we frame that, right? And what the challenges are and what the needs are and how it comes across to different people. Shelter in place sounds fine if you've got shelter, right?
Right.
And so
Stay at
and
home if you're a homeless person.
right, kind of thing, and wash your hands. But there are certainly refugees in camps across the world who don't have access to clean running water and so on, and giving people some idea of those challenges. And I bring up the international perspective because we apparently have people tuning into the show from Sierra Leone, West Africa, Buenos Aires, Argentina. So yes, it is a global uh, challenge that we're facing, and being mindful that we need to hear from people as far as their experience before we start problem solving, right? And before we come up with these kind of packaged answers for people, as well
Absolutely.
intentioned as they might be, right?
I think that's very important. I think a lot of what we're seeing from very well intentioned and smart and caring mental health professionals is advice that is aimed towards a kind of homogenized audience.
Mm-hmm.
And rather than thinking through the kinds of different stress that people experience because of their circumstances. I recently became very interested, for example, in working moms who are now at home taking care of kids who otherwise would have been at school. And what's the advice? I came across one that said, well, you and your child should be sure to get a good night's sleep. So, when the child wakes up in the middle of the night having a nightmare screaming, how are you going to get a good night's sleep?
Yeah. Yeah.
Circumstances that people are experiencing, I think we need to understand better than we do at this point.
Yeah. So we've already gotten questions submitted via Facebook Live, and one of them asks, "How do we best support our clients who are lonely and anxious from this physical isolation?" I think connected to it is, can you share what and where we can access any research that has been done on the mental health impact during a pandemic? So I guess people are sort of looking for answers from experts, but also researching these things on their own. So what sort of resources are you relying on?
Well, I can't steer people to anything specific.
Mm,
There seem to be recommendations that are coming from almost every organization you can think of. National
hmm.
Association of Social Workers has got something up there. American Psychiatric Association has
Right.
something. AARP, which I'm a volunteer for now,
Hmm.
has material that's posted. Mental health associations around the country have things posted, and so on and so forth. So there's a good deal of information out there. As far as the clinical question goes, how can you help your client particularly? I am not a clinician, as you know, Richard, and
Hmm.
I would actually love to know more about what it is that clinicians are experiencing.
Hmm.
They're now working in a different way. Clinicians are largely working now through telephone and video conference.
Yeah.
That must be a very different experience. That, of course, is not a solution to all problems.
Hmm.
So, for example, people who need to get medication,
Yeah. Yeah.
such as people who take methadone for opioid addiction, that's tough. But in any event, I think the people on listening to this certainly have more experience than I do with what it's like out there on the front lines.
Hmm.
Social workers are on the front lines, I'm sure of it, and I would love to hear their stories.
Well, and we'll certainly be covering that in our programming in future segments of Social Impact Live. And I do want to acknowledge that, as a former deputy commissioner in New York State Office of Mental Health, you do have experience, though, sort of looking at how these needs arise and how they are addressed at a larger sort of macro level, right? And so
So,
what do you think the response needs to be at that level?
so let me say,
Yeah.
the New York State Office of Mental Health seems to be doing a remarkably good job
Mm,
addressing issues, and I don't have the website off the top of my head, but they have something called frequently asked questions related to COVID-19.
mhm,
And I think if people go there, they can find lots of information about the policy changes that the Office of Mental Health is making. It
mhm,
seems to me that there are a number of areas that need to be addressed from a policy perspective. Perhaps the most important is addressing the concrete needs of people.
mhm,
When I have 50 years experience with people with serious and persistent mental illness, and
mhm,
I have come to believe there's one primary issue that has to be addressed, and that's stable housing. So I
mm,
think the same thing is true if we care about people who are having difficult times psychologically. We need to care about the concrete conditions that are contributing to that. And that's been addressed to some extent in the federal legislation. Some
mhm.
states are doing more than that, but it's absolutely critical to do that. There
And
also
to
needs
yeah,
to be a reorganization of
yeah,
behavioral health services. So we are accustomed to oversimplify to, as clinicians sitting in offices waiting for patients to come to us. There are some things like ACT teams, which go out into the community to try to connect with people who don't come in. But for the most part, that's what we've done. There's been a very rapid response to the fact that that can't be done safely. And so the federal government and state governments, I don't know all state governments, but certainly New York, Maryland, where I am,
Hmm.
have changed laws and regulations to make it possible to do telemental health services and to get paid for doing that.
Hmm.
There's another big challenge that has to do with the organized mental health system, and that is we have many people who are living in residences, for example, and they're living in group settings. The contagion of this disease is
Yeah.
significant. And the challenge that providers have to meet of finding ways to try to contain the contagion in these residences, which we often have designed to be home-like
Hmm.
rather than to be more hospital-like. So
Yeah.
I think that's another big challenge.
Well, it's
Payment,
interesting. Yeah.
uh,
I mean, I'm, I,
yeah.
you know, we're at this point, and we're looking to state and federal authorities to help to come up with packages and so on. And so much of the focus is on concrete needs, as you said, and sort of getting money into people's pockets and to keep whatever aspects of the economy that are still going, to keep that going and so on. So, and you know, a stimulus package. If you were thinking of a sort of stimulus package for social services, right, to support mental health, what would that look like? What do you think we would need to sort of keep our services in place, and maybe take this opportunity to really beef them up, given probably what's going to be greater need in the future?
Well, that's a question that I could do a whole course on, Rich.
Which you've already done, I'm sure. Yeah.
uh, but I think that there needs to be attention to the survival of mental health organizations and of private practitioners.
Hmm.
You know, more people in the United States get mental health services from private practitioners than from organizations. And they have to also be able to survive financially. But with organizations, New York State has taken a number of steps. One of them is making sure that mental health is a reimbursable service. They've also recently changed a rule about what you have to do to comply with the state contract that will make it possible not to have as many face-to-face visits as were usually required and still get paid for your contract. So there are many steps that need to be taken
Yeah.
to support organizations. I just got an announcement today from SAMHSA
Hmm.
that they will be providing grants to states and territories to help them to beef up mental health services. That's the good news. The bad news is that the maximum grant to a state is $2 million and to a territory is $500,000. So here's New York State, which is already spending several $billions a year, I don't know the current number,
Hmm.
on mental health services, and now they can get an additional 2 million.
Hmm.
Uh, doesn't quite measure up to the need, but at
Yeah.
least the idea is out there. It's also possible under the federal legislation that hospitals, for example, will be able to benefit from the bailout of large corporations, to put
Hmm.
it that way.
Yeah.
Many hospitals are, in fact, large, even multi-billion-dollar corporations, so they may be able to get some help that way. So there are some things that are happening to try to help
Yeah.
organizations. My guess is that there's much more that needs to be done. Hopefully people are working on it and that much more will happen. I am very afraid
Mm.
that without that kind of support, much of the not-for-profit, particularly mental health service system, could collapse.
So we have a question here. What are some ways social work has changed since this pandemic? Do you see, I mean, is it too soon to really see those kinds of changes, but do you see any change in the wind with regard to our profession and how we practice as a result of this?
I do think, number one, I don't see the changes because I'm an old retired guy and I'm here in my apartment in Baltimore. So how much do I know about what's going on? I would really, as I said before, love to have social workers telling their stories.
Mm.
And I hope on this show and in other sources, NASW and others, will start putting out the experience of social workers so we can all learn from it. And we can see that social workers are in the front lines of this. They're not getting credit for what they're doing, but social workers are absolutely in the front lines. and I would love to hear from them.
Yeah,
I
there's a
think
comment.
practice is going to change, Richard. That's my
Yeah.
speculation. I think the genie is out of the bottle for telemental health, and I think that, and I hope that the rules of Medicare and Medicaid change permanently,
Yeah.
so that, and I think that'll be a different way of practicing.
Yeah, and we do have a comment from somebody in our audience who says that I think as therapists now practicing virtually with clients who might feel more isolated or just in general, that we adapt from the usual quote unquote blank slate and disclose our own experiences a little bit more to make us more human, connect more with clients in that way. This person has said, I've found clients have appreciated my emotional experiences of this collective trauma. So yeah, collective trauma affecting, not simply on an individual, but entire communities, right?
Yes,
Mm,
and we are all in this together. So I mean, it's good to hear from a social worker who is finding that some humanizing of interactions, she or he is finding beneficial. I
yeah.
don't want to leave this, Richard, before we mention the
Mm,
fact that people out there are addressing social isolation, which you had asked about earlier,
mhm,
by forming local organizations of volunteers to reach out to people who are isolated.
mhm,
Much of this work is initially focusing on people who are older and who are living alone and
mhm,
who may not have contact with other people. So here in Baltimore, neighborhood associations around the city have been organizing cadres of volunteers who reach out to older people in their neighborhoods. The neighborhood that I live in has a particularly well-developed one.
mhm,
AARP, on a national level, has created a capacity for people to become AARP volunteers and then connect through a sophisticated computer system with people who are isolated and alone and would like to have contact. I think this kind of outreach, this organization of volunteers, this development of a mutual aid approach, is something which is quite wonderful.
mhm.
Uh,
And
and in,
speaking of the Office of Mental Health, speaking of New York State Office of Mental Health, I know that they've been organizing social workers as volunteers to staff a helpline.
I think
Um,
that's right. Yes.
yeah, yeah, and certainly there are existing helplines, emergency numbers that people can call when they're in crisis. Both at a state level, at a national level, and so on. And maybe we'll have that information posted to our website as
A
well for,
particularly good one in New York City.
yeah, yeah.
So
But
I
I,
don't.
I'm wondering, it seems that given the proportions of the crisis and so on, maybe this is an opportunity to destigmatize mental health issues, that people can feel empowered to reach out for help, and that maybe they hadn't sought previously.
That could be. Destigmatization is something long sought and about which I think we've made some progress over decades.
Mm-hmm.
But it's hard to do that. I do think that I hope that people will reach out for help, given what they're going through. This is a very tough time, and again, there are some people who have diagnosable mental disorders, and at the moment, 40 to 50% of them, or before this, were in treatment,
Mm-hmm.
and 60% were not. Not a great record in the United States, so maybe there'll even be some more connection due to this.
Mm-hmm.
And, you know, as I said before, I'm very concerned about the dangers of relapse as people lose access to service if
Mm-hmm.
that's what happens. And all of us, again, all of us are having some sort of emotional distress that we're experiencing with this. And it's hard to find ways to deal with that. But, I think some of these volunteer efforts are promising, and
Yeah.
hopefully there'll be people on the telephone who can help and
Mm.
so forth. But I think there's a lot of work to be done about that, and I hope to see the field get into it more.
Yeah, and my hopeful comment a moment ago, doesn't take into account those people who are at the same time being marginalized, right? During people, immigrants, and so on,
I
refugees,
don't know what's
asylum,
happening. What
and
is happening with
what
illegal, with undocumented immigrants?
undocumented immigrants, and
What is
so
that?
on,
Can they
and
get treatment? Can they get their medical care paid for? Can they have access to any of this? And again, when we think about these disadvantaged populations
mm,
and the experiences that they're having in this both health and economic catastrophe,
yeah,
much to worry about.
yeah, yeah. I'm just curious, from that sort of state level perspective, do you know, have there been efforts to address these kinds of collective traumas, maybe in the wake of something like a 9/11 and so on, that are geared more towards the community level as opposed to individually provided services?
Well, I think that the experience of the 9/11 disaster, for
Mm,
example, and Hurricane Sandy, and many of these things, is that in the crisis phase, the
mhm,
disaster, which is almost what we're in, you are in it already in New York,
mhm,
um, and others in the country will get there, that people get very focused on meeting their concrete needs. So if a hurricane blows away a home, for example, or in this situation, if you don't have enough money to put food on the table and
mhm,
you have to stand in line that for hours and hours and hours to get food from a food pantry, that in that phase, the what works best is having mental health informed people who are the people who are providing some of this concrete help,
mhm,
so that they can sort of in the process of it help people to deal with the emotional issues that they're having.
mhm,
uh, there may also be support groups that emerge, and that could be useful, and certainly Zoom is promising, I think, from that point of view.
mm,
And I just don't know. I know that, for example, some of the psychiatric rehab programs in New York State are doing some remarkable things with Zoom to create group experiences for people who have a history of serious and persistent mental illness and who are now isolated. And they're doing some really interesting and innovative things using telecommunications
mhm,
to try to deal with that.
yeah.
Uh, I would hope to see more groups. I think I would hope to see more groups forming.
Hmm. Yeah, and we've had there are questions about, asking about this psychological effect of people literally becoming invisible to each other. I don't see people or cars moving through my neighborhood. I don't know how many people are, and there's just so many. I mean, this is a crisis, a disaster, but it seems to be in slow motion, right? And things get worse day by day, and we're waiting. I guess, obviously the authorities need to collect to make informed decisions about policy, but it's I think hard for people just to sit, right? And we're asked to volunteer and so on, but for some people, um, you know, th- it's
Well, I
all
think,
well and good to volunteer. Should we be paid for those kinds of activities too?
well, several things. One is that I think that at this point in this crisis, with the possible exception of New York, um, the crisis is virtual. That is to say, most of us don't experience it directly. So we hear on the news that there are so many more additional cases and so many more deaths. Very few people that I know of have actually know somebody who has the coronavirus or knows somebody who has died from it. So my expectation is that we're going to have a change in the phase. I think that we're in a phase now mostly of anticipation and prevention, and that in the next phase, as the deaths mount and the numbers of ill mount, we're going to be in what I'm calling the phase of increased illness and death, widespread illness and death.
Yeah.
And at that point, the psychology is going to shift, and that more people will be experiencing a dread of mortality, and many more people will be experiencing grief. And I know next week you're going to be
Hmm.
having a show on grief, which I think is very timely, because how
Hmm.
people are going to deal with grief when houses of worship are closed down, when it's not possible to have funerals, when it's not possible to have a burial with friends and family at the graveside, when bodies are being put into makeshift morgues. How people are going to
Hmm.
deal with those very powerful emotions is, I think, a very serious question that we're all, I hope not, going to have to address, but I fear we will. If the public health predictions
Yeah,
are
well,
correct, it's going to get much worse.
I'm sort of serving as the canary in the coal mine. And I guess that leads to a question. So what are all the ways the social work communities can do to check in with workspaces, corporate leaders, any partners, right? To influence, to lend our perspective and resources to a potentially scary shift in advance, so that we can help create an awareness before things get worse.
Well, I do hope that the profession will step up and do exactly what you suggest. I admire our
Mm.
profession because they're out on the front lines and they are dealing with things that you don't have to deal with where you are, and I certainly don't have to deal with here in my lovely apartment in Baltimore. I admire them for what they're doing. But I also think that the field of social work should be stepping up and talking to leaders of the private sector,
Mm.
leaders in the public sector. I think that social workers have stories to tell and thoughts about the formulation of private and public policy, which are really critical at this time. And I hope that social workers will become more prominent in speaking in the court of public opinion.
Yeah, so let's look in SW is doing at the national level, and also with regard to our local chapters is might be one place to start. So thank you to our audience for both the questions and the comments and suggestions. I want to thank Michael Friedman for coming here today. Thank you, Michael, so much for being on SAC Live.
Well, thank you for inviting me back. It's nice to be back at Columbia, as I said before.
Yeah, and I think your suggestion is well taken, that maybe we need to dedicate a future program just to the voices of social workers out there on the fronts who are doing the work and continuing the work that we've always done to attend to the needs of people who are being forgotten. So
I think it would be a
thanks
great
again
idea.
for
You
that.
know,
With regard to, yeah.
we're all worried about the medical personnel, as we should be. I mean, what they're going through is just astounding, and they need a lot of help and
Hmm.
support. But nobody's realizing that social workers are out there on the line too. And I
Yeah,
think it would be
yeah.
great for social
And
workers to step up, tell their stories. And if you can do a show on it, all the better.
all right. Thank you, Michael, and thank you all for joining us today for this special edition of Social Impact Live. We'll be Tuesday with our next regularly scheduled program, which brings Dr. Kathy Shear to talk loss and grief during the COVID-19 pandemic. So until then, stay safe, stay strong, and have a good week. Bye.
Bye-bye.